Hello everyone, I'm Eglys Gonzalez from Patvocates, and I'm sorry I cannot be there with you, but I hope still this presentation is useful for you. Today we wanted to present to you a general overview on what patient perspective and patient involvement is. And so to start doing that, we need to go through what a patient is. And technically it's a recipient of a healthcare service that are performed by healthcare providers. At some point, we all have been a patient, whether we went to the doctor for a flu or for a back pain, or we went to a doctor due to a chronic disease or a life-threatening disease. There are many levels, but at the end, we all are different. Every disease takes a different path, and we also have different emotions and we value different things from a therapy or from outcomes, and we handle a same diagnosis differently. So there are many ways on how patients go through same diagnosis. Even though there is a same diagnosis, a same therapy, the patient perspective can differ from one another. And that is then what a patient perspective is the patient's own experience on a specific disease or an impact of a therapy. It's a different view of what we can see as a healthcare provider or as a researcher. And that is what here we wanted also to do. We are in a project, we are developing something, we have a view on what we want to develop, but we also need to see the patient's view and the patient's perspective, because it can be very different from what we see or what we think it's great and it's good and it's great outcomes and so on. And when we think about patient's perspective, it is in many levels. It's whether including symptomatic facts or intellectual or psychological or economical. There are many ways you can name it. It's anything that could have affected the patient's life through a diagnosis or a therapy. And there are different ways to capture the patient perspective. There are different depending on what we need, whether it is an individual perspective or it is an aggregate one. Individuals could be, for example, a PROM, patient-reported outcomes, or an interview, or somebody reviewing a study protocol. It's an individual perspective, although sometimes patients as patient representatives, they can have and they can bring the view of the community. But then when we think of an aggregate view of the patient, you can think of a survey. So where we capture then the perspective of many different in the community. But they also interrelate. This is a flexible system, because I can, of course, then take 800 of prompts from a study protocol, from a clinical study, and analyze it, and then I will have an aggregate perspective of the whole patient community or the patient population that participated in a clinical study. What is important here is that we include the patient's perspective in the development process, and that brings us then to patient involvement. Patient involvement technically refers to systematic inclusion with consulting, decision-making, and co-creation rights of patients across the research or development process, or a project like ours, for example. There are different levels of participation, and here you can see this in the Arstein's ladder. From non-participation to tokenism, in which patients are not really participating but just consulted or informed, all the way through citizen control, which is then having patients as partners, for example, in the co-creation process of something. I know I'm showing you this ladder in red and green. It doesn't mean bad and good. is just the levels, just showing the levels. So non-participation, you can think of a surgery where you don't need any patient participation, so it's fine. It's just to think about these levels depending on what we are doing and what could be good for the project. So then you can think whether just a consultation is good or whether we need a patient as a partner. So this whole concept brings us to what you may have already heard, what is patient and public involvement, which is then really involving or actively involving patients or carers or advocates or service users or anyone from the community in the research. But when we think about a patient or a patient advocate or a patient representative, we should avoid to think that a patient is, that old granny that has no clue of what we're doing, has no idea of research or drug development or anything. We need to think that a patient has gone through an experience of a disease diagnosis or a therapy, but they have also studied. They are knowledgeable people. They have studied on regulations, on drug development, on their own diseases, technical knowledge, healthcare services. They are really people that can support us to achieve our goals and our outcomes. Patient advocates or representatives, or all of them, they support patients and their families, but they also can help clinicians to provide a better service. They can influence regulators and payers. They can tell policymakers to do policies for patients, and they can also then educate themselves, or others. So they are a whole package that can be that piece of the puzzle that is missing in our research and or development. So we should consider that and include them structured and significantly in our projects. And just to end up a bit and give you a bit of an overview on patient involvement and how it has been happening in the last years. Of course, in the last couple of years, it has been increasing a lot. It has been required by many funders, by many organizations, and it's heard a lot. But it has its origins long time ago, starting with the HIV movement, which was an activist campaign. But of course, it required an activist campaign and protest and so on, because it was a real emergency at that point. But they achieved to accelerate drug approval processes and expand the trial participation of patients. And the FDA responded to that. And when you think about it, it's basically what we have currently when a patient reviews a study protocol, not protesting, but just reviewing and giving a feedback. And when you consider that feedback, the clinical study is improved and it's more patient-centered and ensures that the recruitment is better, the inclusion and exclusion criteria are more realistic. So it is more or less the same. So patient involvement has been considered by many organizations. You have here the IHI, FDA, the EMA, and just to bring you a couple of examples, here is a scheme where patients can give a good feedback in the drug development process, whether it's from protocol design to informed consent revision or fundraising for research or study reporting, but also goes all the way to post-approval processes. And the EMA, for example, has taken this very seriously, and they have patient involvement in a consistent structure. So they have patients included in all their committees. So it is happening. I know it's something that might be for some of you, because I know some of you already know about patient involvement very well, but that could be a bit tricky. There are documents you can go through to learn a bit more. There are guidance documents on how to interact with patient organizations and or patient representatives. There are also code of practices that have been developed not only by patient organizations but also by pharma companies, for example. And also there is a place where you can download contracts that could be used between pharma companies or any in private institution with patient organizations or a patient that are then fair to patients but are also compliant, and they have been developed between patient organizations and pharma companies. So you have these links in the presentation afterwards if you have any interest to go through them. And then I wanted to finish with a couple of references. I'm not going to go through all of them, but just so you know, there is material in PubMed that we all know on research and publications, peer-reviewed articles on patient involvement and how it can improve medicine outcomes, how it can improve the cost of drug development, and so on. So you can go through those to learn a bit more on that. And then I wanted to finish just with this one, because I think it applies a bit to Cynthia, that says that patients are their caregivers may have more confidence in research outcomes if other patients have provided input to their development. This applies, of course, with Cynthia as we are developing a platform on synthetic data. I know it is the end user might be the clinician, but at the end, the clinician with the patient should come to a decision by communicating, and it affects, and we need the patient perspective. Just as an example, and I know here in the consortium we have many engineers, whenever you generate product, a platform, an app, a system, whatever, you do end user testing. And in this case, it's not only important to have the perspective of the clinicians, but on the patients, on what they expect, what are their questions, so we can answer those questions in what we are developing here. So just as a close-up, I hope this has been useful. If you have any questions, just let us know. Following this presentation will come then my colleague Olga Millán to explain to you how we are doing patient involvement in Cynthia. Have a nice day. Thank you very much.